when it was first hitting them, hitting everything, baby, everything, every fucking where.
Mm-hmm.
You need to get on PrEP. You need to get on PrEP. Remember how the message of condoms was?
I know.
Mm-hmm.
That was the message of PrEP.
I get
okay?
it. Except for with women, they weren't pushing it.
Right, and that was my thing. I was like, I would see it all the time.
And
I was like,
that's why women thought I have sisters that I've taken care of who are living with HIV and got it within the past 10 years and said, shit, if I had known that PrEP was for women too, I would have taken it back then. And they feel kind of ripped off,
yeah,
and a little bit pissed off about that. So I just wanted to acknowledge that. But you're right, Demetrius. It was literally like all they were pushing. It was like condoms.
Yeah, you need this. You need this. You need this. And my whole, especially when everybody was giving it away for free. Oh my God. And, it just became this, and everything in my soul, I was like, no, somebody is paying for this somewhere.
Mm-hmm.
Because once you get on it, there's a regimen that has to be done with this. So somebody got to pay for this on the back end, or this is the trick. And I always felt like it was just like a dope dealer pushing some shit on me. That first hit is free. Everything else is going to have to cost you. So in the beginning of all of this, I was like, no. I got a good sister friend of mine, honey, was like, we interviewed my baby, honey, worked for the health department. And he was like, listen, I understand and this, that, and other, but the science is this and the science is this and the science is this. I said, I understand the science, JS, honey, but the way how everybody keep pushing this message, it is not sitting well in my soul, honey. Something just, it ain't 100% with me. So now for those who are like me, what is your message there? Because like my whole idea for risk assessment, I know, well, I'm over 50 now, so I'm not the whore that I was back in my 20s and 30s. Okay. But then
lies you tell.
Look, are you sure? Look.
No, but on the seriousness, oh, wait a minute, because see, no, I have to say yes, because the hoe that I am today, honey, oh my God, she tame.
Yeah.
She is real tame. Oh, she is real tame.
I be over there, I be looking, I be like, who over there? Where you at?
But I have to say this though, and that sex is my addiction.
Right.
Oh yeah.
Okay. So a lot of me in my early 20s and 30s and carrying on, a lot of that was acting out.
Right.
And carrying on. And when I came to understand that,
right,
then we had to put some things into perspective. And then I had to learn how to have sex healthily, right, and in a healthy way. And then understand, no, I'm one who likes the group thing. I'm one who likes to go to sex parties.
Right.
I like it.
And there's nothing wrong with that.
Oh, hello.
He don't think nothing wrong with it anyway.
I know.
And even if somebody thought it was, he wouldn't give a damn.
I don't give two cents less than a good damn, honey.
I love him.
But at the same time, in understanding that, I had to also understand my triggers in it too, because being around it is like, okay, I'm in this atmosphere, but I also know when I am just having fun versus when I'm driven because addiction is saying, bitch, you can't stop and you can't control yourself. And I've learned how to do all that. So I'm one of those particular people. My question to you, because I know this is rambling, my question to you is, as a physician and coming up with clients such as myself, what is it when we come to risk assessments and understanding how is it, what's going to work for you? How is this, what is it that you do with clients like me?
Right. So, if you were to come into my office, I would ask kind of what you're comfortable with. I would go over all the behaviors that you do, whether you're sucking dick, whether you're eating ass, what you're doing, whether you like to get screwed or whether you like screwing other people, like condoms, everything. I would go over all that stuff, fine tune like exactly what behaviors you're engaging in, and then talk about what options based on that would probably be best for you and what you would feel most comfortable with. And then we would have to go through that together to figure out what would be best for you and your lifestyle. Now, what I will tell you is this: PrEP, a lot of the clinical trials it's effective in reducing the likelihood of catching HIV anywhere from like 90% all the way up to 100%, depending on what study you look at.
Okay.
But just be clear that you're not crazy to have a little bit of skepticism to be like, this probably isn't 100%. A lot of the studies that have evaluated PrEP have found that it's not 100%, but it is in the 90s to high 90s. So that should be pretty reassuring. And instead of focusing on, well, oh my God, there was one person that once got HIV while they were on PrEP, think about the hundreds of thousands who haven't gotten it.
Right.
That's not how the media works. The media works on the one negative story rather than focusing on the positive story. So that's the first thing I would tell you, is that, you know, your skepticism or caution is warranted, because that's on you. That's your personal freedom in like what behavior you're comfortable with. The second thing is that it would be, like I just said, what your option is. So it would be just about what is going to be best for you. And now that we have 2 pills that are available and an injectable, we would sit down and talk about, okay, what options are going to be best for you? And they've actually changed some of the guidelines recently for PrEP with regards to how often you have to come into the clinic for a follow-up to check your kidneys, because the one pretty rare side effect that we see with PrEP, at least Truvada, is that it can irritate the kidneys. But even that is not that common. That you know, I can tell you probably in the 10 years that I've been prescribing Truvada, I can count on one hand the number of people that I've had to stop because they've had some problems with their kidneys. But they've relaxed a little bit of, you know, how soon you have to follow up. So that's point number 2. But you can do it the way you want to do it. You just have to work with your provider about it. The third point is that you mentioned a common concern for people, which is about cost. So it's like, oh shit, I heard these HIV medications cost a ridiculous amount of money. And a lot of times they do. But Truvada is now generic.
Really?
So, yes.
So the insurance pay for it?
Insurance will
I didn't know that.
Insurance will pay for it. The other part of that, so Descovy and the new one, Apretude, or it's also called Cabotegravir, those 2 are not generic. Okay. So those 2 will still be at high price. But if you have insurance, your copay could be anything from $0 to like maybe $50 a month to get those done. So that's one thing. Truvada, however, is generic. So it could be potentially a lot less. Or if you don't have insurance, it's not going to cost a lot. Now, here's the other thing with that you need to know. There's an organization called the United States Preventive Services Task Force, sorry. And they're a preventive task force that actually puts on a grade scale different kind of preventive health measures. So, for instance, they make recommendations about how often women need to get mammographies, how often individuals need to get screened for lung cancer, colon cancer, flu shots, other vaccinations. They did research they looked at all the studies on PrEP, and they gave it an A rating, a grade of an A, which means that the studies conclusively say that this is a preventive health service that, you know, people should be offered. And because they give it an A rating, and this is something that President Biden had to put into law back in October, when the U.S. Preventive Service Task Force, when they actually give it an A, that means that insurance companies, private insurance, have to cover the cost of that prevention tool. And then for PrEP, they have to cover all the follow-up visits and the follow-up labs.
Oh, really? That's good.
Come out of your pocket.
That's real good.
Where does the shots work the same way, doctor?
Does what?
The shots. Will the shots work the same?
Yeah, well, they'll have to update it because they'll have to review the data, and the shots just got approved in December. So I don't think the Prevention Service Task Force has actually reviewed all the data to make a conclusive recommendation just yet. Okay. But for oral PrEP, they have. And so you shouldn't have to pay for a lot of these lab tests. Now, that was made conclusively that private insurers do have to pay for all that back in the fall. But what you hear about, and there was a recent story I saw in the media about this, is that insurance companies will try to wiggle their way around that and still send bills to patients, and patients freak out, and then they get turned off, and then they don't want to use the medication anymore. And so if there's someone, you know, that's on PrEP and is worried about the cost for follow-up visits and labs, their insurance company, especially if they're paying every month out of their paycheck for insurance, should be covering all the expenses for that. And if they do get a bill, they need to call and fight back or bring it to their doctor's office so their doctor, their nurse practitioner, their physician assistants can fight for them. So those are the things. So, you know, it may get a little dicey. I think Medicare is supposed to cover it. I'm not sure how fully Medicaid does. It may depend on the state, because Medicaid is more of a state-run program. So it may vary a little bit. And if you're uninsured, there are other ways to kind of get around it. But if someone wants PrEP, they should be able to get it and not think first like, oh my God, this is going to cost too much. I'm just going to write this off. Because if you are having sex without condoms, whether it's one partner or you have several partners, it doesn't matter. By a behavioral standpoint, you would be a candidate for PrEP. And so there shouldn't be anything to get in your way of getting PrEP. And there are a lot of programs that can help out, both patient assistance programs to help with the cost